Why did I choose not to do a reconstruction? When you are in high risk for breast cancer like me and you're going through a preventative surgery, usually there are two surgeons, the oncologist who removes the breast tissue and then the plastic surgeon who reconstruct the breast. And when you meet with them for a consultation, they would throw a lot of information about like the options like implants or fat grafting, and there are a lot of different approaches for reconstruction. And for me, all of those options didn't sound that good. I was hearing a lot about issues that come out, a lot of complications, just a healing time that's super long and painful, pain on the chest, and the fat grafting surgery that is actually like a whole body experience because they have to cut off that fat from another part of your body, like your tummy or your hips or something, and you have to heal not only in your breast area but in a major other part of your body. I didn't want to go through any of that, but still I was afraid to just do an aesthetic closure, which is when you only have the oncologist work on you. They cut off all of the breast tissue and then they just close it up with whatever incision that you decide on, and then you're just flat. And I was afraid with that approach that one, it's gonna be kind of scary and there's a chance that you actually get a concaved look, which I was kind of afraid of. Still, this was a really tough decision. I want to talk about how I came to decide on that option anyway, but I'm gonna have to need a part 2 for that. I'm gonna have my boobs cut off in less than a month, and if you didn't watch the first part about why I decided not to have them reconstructed, then watch that. The top reason for me was I don't want to do that for someone else's sake, and I wanted to decide for myself what's the best path for me if I actually want a reconstructed breast or not, how much these breasts are important to me. And I felt like these are not actually even my breasts. It's not gonna feel real. I'm not gonna have any feeling on the skin or the nipples. And if it's not gonna feel like me, then it's a foreign thing anyways. Also, while I was still married, I felt like the option of having a flat closure wasn't even on the table, because whenever I brought it up as something that I'm considering or thinking about, my ex-husband would kind of put me back to place and tell me, no, that's not an option. You're gonna do a reconstruction. And now that I think about it, this is nuts that I just kind of took that as a given. It is a really huge red flag, but I just figured out that I was prepared to do a reconstructive surgery for someone else, and not for myself, for my husband. But then going through this divorce, it brought up some new challenges, like how I'm gonna go on to dating life with no breasts. And would it be more sensible to just have this reconstruction so that I make my life easier to potentially go out, meet, and potentially find a new partner? And that was something that kind of kept me on the fence for a while, but I'm gonna have to continue to part 3 because it is kind of a mental process that took me a long while to land on how I decided not to go through a reconstruction. Plastic surgeons, they usually really like to reconstruct breasts. So every time I would meet with one, and I think I met with at least 4 of them, they give me the whole spiel of all the options of reconstructing your breasts. And it's a long spiel. It doesn't leave a lot of time to ask about, what about my flat closure options? Because plastic surgeons, they don't really like the flat closure because there's nothing to do there, right? Most of them are used to doing breast reconstructions with implants, with fat grafting. And then when I come to these plastic surgeons asking about the the option to just do a flat closure, they're really, really not excited about this option. So they only just like brush it off as an option, but I was feeling like this isn't a good match. So I was looking into a surgery that's called Goldilocks. It's an option that's kind of in the middle. And with Goldilocks, you're not really reconstructing with implants or fat grafting, but with the skin and fat tissue that's left after you remove all the breast tissue, and you kind of reconstruct that to make a little mound and a smaller size breast. So I heard about this option, and it's kind of an old new concept, and not a lot of plastic surgeons are happy to do that or have any experience to do that. And it's hard to find surgeons that would. I went and found the one New York plastic surgeon that was written in the directory as someone who would do the Goldilocks procedure. I went to see her in New York, and she saw me, and she wasn't so excited about doing the Goldilocks in my situation. I guess I don't have big enough breasts for that, and I got the whole spiel about normal options for a reconstructing surgery. I was kind of disappointed that I'm not the best candidate for Goldilocks. So the next thought that came to my mind is, what about transgender top surgeries? How do they do that as an aesthetic closure to look like men's breasts? And I went and talked to a few people that did this surgery for gender purposes, and I found out that different kind of plastic surgeon do this surgery with a focus on the aesthetic of turning a female breast into male breast. So I'm going to continue in the next part. I wanted to talk about what type of surgery I am hoping to be getting for my double mastectomy preventative surgery. I decided not to do reconstruction, but also I didn't want to do a flat closure without plastic surgeon. And I decided to talk to a few people that went through top surgery from female to male and learn about this subject, because in my mind it's pretty similar, even though there's the oncology aspect to it. I was looking at how for these surgeries, there's a lot of emphasis on the appearance and the end result of the chest being more aesthetically pleasing. And I've seen that most of the pictures of cancer mastectomies, you see that it looks kind of like this kind of incision, no nipples, a little bit of concave look a lot of times, and just there's a specific look to it. And if you look at the pictures, top surgeries for transgenders, there is definitely a different kind of look. For starters, they most cases spare their nipples. They're trying to make it look more masculine, so a lot of times it's more like a squarish look. They bring the nipples a little up so it looks like the chest muscle. And of course, a lot of times there's testosterone used for these cases, and that has some effect on the appearance of the scars. But also for transgender top surgeries, a lot of times there would be different options for the type of surgery, because they don't have to be needing to take out every last bit of breast tissue, because it's not a cancer risk reduction surgery. So they can do something that's called keyhole, which is much less incision heavy, because they cut around the nipple and then they take out the breast tissue from a smaller area, and then they're left with less scarring. Also, there's a really big aspect of your original breast size and shape, and some people would be able to have more options or different options than others. But anyway, I was intrigued about, first of all, about the amount of different options and types of incisions and what to do with the nipples. And there were a lot more conversation here and options regarding flat closure than what you would find for risk reducing mastectomies, which were about just, do you want the scar to be horizontal or at an angle or with a curve? There were 3 options. That's what I saw. So you can either choose this, that, or that kind of thing. So I had talked to a trans guy that went through a surgery here, and he had consultations with pretty much all of the plastic surgeons that are doing that sort of surgery here in the area, and he gave me all the input from what he knows, some intel and names. One kind of stood out for me, so I went to see the plastic surgeons. I went for this consultation, and that was the one time that I saw a plastic surgeon that I felt like we actually might be a good match, because I told him what I was looking for. I was looking for no implants, no fat grafting, no reconstructing that's gonna take me a long time to heal, but I'm not looking to just close it up without any aesthetics. And also, I didn't want to lose my nipples, obviously. So the way that he responded was he was very excited about what I'm trying to do, and he just said that he was just doing one of these surgeries for as a cancer risk reducing preventative surgery a while ago to an athlete that she, like me, didn't want anything disturbing her kind of athletic lifestyle, and he was doing something similar for her. And he has all the experience of doing all these top surgeries with a plastic and aesthetic focus to them. So that was the first time he operated on someone that was looking for a risk reducing surgery, and the results were, he showed me the results, and it was pretty much flat, but it looked not super masculine chest, but just in between, not super feminine, not masculine, in the androgynous kind of spectrum. I like that idea. And he said that he also is able to use the spare skin and fat, and use some biological filaments that they're using usually for reconstruction to create a little bit more volume so that it's not totally flat and you can see the concave look. That's what I was afraid of. And he also is going to be matched up with the oncologist surgeon that I also saw, and I had a good, like, a gut feeling about both of them. I'm kind of happy about the way things turned out and how I continued looking for more plastic surgeons that might be able to accommodate my perspective and what I'm looking for, the situation for myself. And I think these days, when the flat closure is not that common and there's not a lot of options for risk reducing mastectomies that are not involving any reconstructing, the whole responsibility is pretty much on us, the patients, to go and do all the legwork on finding these special plastic surgeons that would do something different than usual. And it takes a lot of involvement that is definitely hard for me to do. And I was noticing that when I talked to a person that was doing a top surgery, and they were really excited about this whole journey. So they had kind of the mental ability to do all the researching online, looking at like Facebook groups and talking to people and going to all these consultation in the different mindset of like, I'm excited to do this change. And for me, all of these involvement in the process has triggering this dread and fear reaction. So for me, I'm doing all this process without really wanting to do it. It really weighs on me psychologically. And the two options, I guess, that you have in this situation is one, to just do the easiest thing, which is usually just the most common thing. And even with the most common reconstruction, there's still a lot of bureaucracy and involvement that you have to do, because it is this huge operation. So there's a bunch of stuff that you have to be involved with. But the other option is to actually take the less common way and try to do some extra research, see the best path for yourself as an individual, which is a lot of times the harder way, that requires a lot of involvement, that usually is kind of tough emotionally. So I did that, but I feel like I could have done a lot more, but I did my best, because every time I have to deal with one of these things, it really gets me really emotional and hard to be proactive. So I really feel like I did my best. And at that point, it's up to the process to put my best faith in these people that I did my best to choose. Just let go of whatever thoughts about controlling the situation and just go ahead and continue to see this process through. So that's where I'm right now. And it's definitely hard for me to do, to just sit back and relax while I don't even know how I'll come out of it. And it's really important to know that more options are available and you don't have to do either that or that. But a lot of times there are secret option number 3. Anyway, good luck to everyone who's going through this similar journey. I'm glad you asked that. What's the standard right now if a patient's having a mastectomy and chooses not to do a reconstruction? Well, from what I know, which I'm not sure is the same in all areas, but it's not that common. So not a lot of patients do choose not to do reconstruction if they're doing a preventative surgery. It's more common if it's a healing type cancer surgery, and usually there's for these cases they have only the oncologist surgeon in the surgery, and they do their best to do an aesthetic flat closure, which means that they really try not to have any kind of skin left over or flaps. They call it dog ears. Just try to keep the incision patient would request. It can be more rounded or like a straight line, or a few options on that. And usually they don't spare the nipples as well. I choose to do a closure with nipple sparing, which is a little bit more complicated. And I'm hoping that with gaining popularity for having a flat closure, it will be more common and more surgeons would want to step in as plastic surgeons and do kind of a reconstruction that's without any implants, just making sure that the flat chest still looks like a chest with nipple sparing, and hopefully my result would be looking better than the normal flat closure, but I have no idea. I really hope so.